Hola, hola, y bienvenidos a Tu Salud, the definitive podcast for Latine health policy. We're here to talk about all things Latine and health. I am Dr. Seciah Aquino, Executive Director at the Latino Coalition for a Healthy California. And today, I am joined by Dr. Jeffrey Reynoso, Professor at San Diego State University School of Public Health, most recently U.S. Health and Human Services Region 9 Director, and of course, former LCHC Executive Director. We focus our conversation today on the power of authentic leadership, strength and joy in our cultura, y la fuerza of our diversity, lived experience, and hope for a better tomorrow. So with that, let's get started. Hola, hola, y bienvenido a Tu Salud. Dr. Reynoso, how are you doing? Thank you for joining
Hola,
us.
Dr. Aquino. I thought you'd never ask. I'm so happy to be here.
Of course. We're so excited to be having this conversation with you. You are a friend, family of LCHC, and we definitely wanted to chat and, get to know you a little bit deeper. The work can get heavy, the work is busy, and it keeps us focused, but there is so much more to us.
Mhm.
And today, I would love to start a conversation by just listening to your story. Tell us a little bit more about your journey, personal journey, and how you got here.
Well, first of all, thanks for la invitación to be here today. I think one of my goals for our conversation today is to share stories that maybe you don't even know. We've worked really closely together over the last many number of years. So that's one of my goals to share some stories about my background, how I came to be. So to answer your question, I'll just start from the very beginning, and my story and my background start with my parents. So Jesus and Alicia Reynoso came to this country as teenagers,
Mhm,
and they grew up in a small little pueblo in Los Altos, Jalisco, in Mexico. Shout out to Jalisco. And they came to the U.S. like so many immigrant families to look for opportunity. My dad, he was only able to have an education up until about fifth grade. My mom was able to have an education up until about ninth grade.
mhm,
But the economic circumstances of their family, and my mom's the oldest, really required them to come to the U.S. out of
mhm,
obligation to their family. So, I try to put myself, in their shoes sometimes. Like my dad, his first time in the U.S., he was in the last cohort in the last year of the Bracero program. And this
mhm,
was a program that was established by the U.S. government to bring low wage labor in the agricultural sector. He often tells a story about he landed in Texas and he was paid pennies for the hard work of being in the fields. My mom, she had some family in the Santana, Orange County area, and she worked a couple of different jobs in the fields for a short period of time in the area of Irvine. But the job that she had was working for a laundromat that
mhm,
partnered with a lot of like the hospitals and
mhm,
hotels in the area. And so they were working class. They were from the same small town, met each other there, and ultimately decided to get married and start a family. They had four boys in total. So they originally settled in Southeast LA, area of
mhm.
Huntington Park. They later moved to Downey. My three older brothers were born, and they established the start of their American dream. So I like to start there just to like honor that story of my parents and wanting to come here for a better life.
That's beautiful. Thank you so much for sharing. There is so much power in where we come from, right? Because those values get ingrained, they're taught to us in the way that we see our parents many times sacrifice their well-being for ours, right? Sacrifice opportunities, families. They have to start over many times from zero. And all to see their children succeed, all to make sure that we get ahead and we continue to support and bring back opportunities, not just for the family, but our community as a whole.
That's so right. And being able to navigate systems that weren't set up for us. So my next oldest brother, Orlando, he was born with a disability. So he has cerebral palsy, and at the time, the medical term was mental retardation. So he
Mm.
has kind of the cognitive ability of maybe like a toddler, 4 or 5 year old. And, thinking about, like, my mom, having to, take my brother who needed, really around-the-clock care, going through different buses and having to navigate doctor's appointments with specialists, in a language that wasn't her own, and having to do that primarily on her own while my dad was at work, trying to provide for the family, having to juggle, all of that. It's a sacrifice, but our parents, our families, they're so strong to be
Yes.
able to get through that and also like thrive and do it with joy, right? I know we'll talk a little bit more about my journey, but to do it with joy and happiness, and have that laughter, in the
Mhm.
home, it's pretty incredible, like what we go through.
Yes, I love that you say joy, especially in this very heavy year for our community and our systems and everything that we're facing from every area. But because joy is part of our culture, we are able to be resilient because of that joy, because of our family values, because we love life. And even if there's just huevitos y frijolitos for lunch, right? There's joy in that. And we share that even with neighbors, families that come over to share a meal. There is that sense of strength and community, even when we go through really tough situations.
100%. And I know we'll get into more of my academic journey, but one of my mentors in undergrad at UCLA, Dr. David Hayes Bautista, he was really one of the thought leaders around the Latino health paradox. And that's what
Yeah.
he talked about. Like, despite all of the social,
Mm.
economic determinants of health, Latinos are able to survive. And it's not all of the negative factors, but there's also all of the positive factors of our
Mhm.
community, our Latino community, family, food, faith, culture, all of the things that make us who we are as a community. And regardless of what country we come from in Latin America, regardless of our personal immigration story, there is that connection of our culture. And I think there's that phrase, La Cultura Cura, right?
Yeah.
Culture cures. It's so real.
Yeah. That's where we can find a lot of our healing. And to your point about systems and navigating systems that weren't created by us or for us, right? But not only do our community members, our family members turn into experts at navigating these complicated systems, we're able to not just use it for our benefit, but we are able to bring back the knowledge and the wisdom to the rest of the community. And that's what we see many times with our work with promotores, right? The knowledge base and the wisdom doesn't stay within a family unit, it expands to the whole community. And because of that, the state as a whole thrives and can do better because families are sharing those resources with each other.
That's so true. And it's, I think when I was at Latino Coalition for Healthy California, one of the reasons why we partnered and invested in the community health worker, the promotor workforce is because of that, because we know from our community's perspective how powerful that is. Kind of getting back to my personal story and how I came
Yeah.
to be. So fast forward. my dad, he had a good, well-paying union job. He was a meat packer in the city of Vernon, and all of those meat packing facilities, they moved out of state to the Midwest, and so my dad was left in a position where he was unemployed, and they were struggling. My family was struggling, and that's what ultimately led them to make the decision to move to the Central Valley, where there might have not been as much opportunity, but home prices were
Mhm.
and rents were more affordable. So fast forward, my mom probably wasn't expecting to have another kid, but she had me in Modesto. And then shortly thereafter, we relocated to Visalia, California, in the Central Valley. So that was kind of the start of my life, right? Growing up in the Central Valley, and
Yeah.
my childhood, while we had a lot of economic challenges. One of the one in terms of that time in my life, something I take away from me in my years in Central Valley and the Valley was was working in my family's small business. So my dad and my mom being entrepreneurs and immigrants trying to make things work. We started a small business selling name brand tennis shoes in the swap meets. Whether it's at El Mate, flea market, La Pulga, whatever you call it, we would, every weekend we would work, my brothers and I, supporting our family business. And, it was a way that, at the start of my life, I learned so many like life lessons. Obviously, like hard work was obviously instilled in me, but we also like just bringing it a little bit broader, that kind of spirit of service to like
Yes.
other. I didn't see it as work. I was there to contribute. Obviously, like I was small, I was a child. It's not like I was clocking in, my 8 hours at a work site, right? So don't get me wrong there. But what I did do was I supported how I could, right? Every so often we'd have a customer and, I would like, add up, the cuenta, right? And help my dad out with some of the numbers. And, early on I learned how to,
Yeah.
do percentages. We had a 10% discount, and I learned that, as a 5 or 6 year old. So learn numbers really early on. But,
It's
I
that
think
business acumen. That's where it started.
that's right, that's right. But, I think that's, something that it was instilled by my dad and my mom, is that, whatever you're able to offer, you do, and you do it in
Mhm.
service to others without expecting anything in return. And I think that's something that's so core to who we are as Latinos, as a part of our Latino identity, is that like culture of like service and being there for others, right?
Yeah. I love that. And I would love to go a little bit deeper into that service to others and how that reflects in the business world, in a professional setting, and
Mm.
when we talk about leadership. And what does it mean to really be a servant leader and to lead from a place of power in our culture, support each other, open doors for one another, pull each other up, knowing that when we all help each other, all of us succeed even more. What do you think about that?
I mean, I think that's so important, in as especially for those of us that not only are first generation to, get college degrees, but we're first generations in the workforce. I
Uh-huh.
often find, and earlier on in my professional journey, when I was, in a corporate environment, I almost felt like I had to adapt to the environment that I was going into, right? Where is, American culture, for better, for worse, it is an individualistic culture.
Mhm.
And it is about, if I'm winning, then I'm good. I don't care if you're losing, right? But
Mm,
it took a lot of support from, internal mentors
yeah,
at organizations where I saw them lead in a different way. And by the way, they were not necessarily other Latinos or Latinas in the
yeah.
workforce. But I have some incredible AAPI mentors that have helped me throughout my career, incredible African American mentors that have helped me in my career. And I saw how they brought their culture in their way into the workplace. And that provided a space for me to feel like I could be a different type of leader, right? A servant leader or a leader that was uh, not worried about creating competition in the workplace, but and not have interactions be transactional, but really transformational. And I think inserting that that Latinidad in all systems, right? Whether it's in business, in government, I think it's going to only benefit all of us, right? Because we're not thinking about the bottom line, but we're thinking about supporting one another. One of the great quotes that I always use and still love, as I think about like mentorship in particular, and creating spaces is, in a boardroom, there's a certain number of chairs, right? But it's our responsibility as Latino leaders, as the first in many places and spaces, to bring that extra chair, right, to the
Yeah.
table, and support one another that way.
Yes. Bring that extra chair, open up the door, make sure that more of us are in that room because the more that our perspectives, our lived experience are able to guide and shape the work, the stronger we are as a society. Many times in our work, we talk about Latine and indigenous communities make up 40% of the Latino population. By 2050, will be 50% of the population. And we say that in acknowledgement that we're not alone, that we are stronger when we hold hands with our Black community, our Asian community, our indigenous native communities to really say, sure, these systems weren't created by us or for us, but we have now the opportunity, the privilege, and the responsibility to shift them to a place where we can support, we can help each other, we can make things better, and not stay stuck in that competitive spirit that you mentioned, right? Let's not live in that under-resourced mentality. No, let's live from an abundant place and an abundance of support, abundance of resources. And if we're all given a little bit, right, if we share it, that will multiply itself.
And to that I say amen. Like 100%.
I
Everything you
love
said.
it.
Amen.
Yes. We
Uh
gotta preach.
And what I'll add to that, because I do want to acknowledge, and our conversation is not about the doom and gloom that we're currently facing,
Yeah.
right? I really want to focus on it from a place of strength and power. And it's a hard time in our community right now with what we're facing at the federal level, the attacks on immigrant families, on communities of color, on LGBTQ, especially trans populations in this country, being scapegoated for every problem imaginable, right? But in California, in the California context, there has never been more members in the
Mhm,
Latino caucus in positions of leadership. The
mhm.
current assembly chair is Latino, right? And the incoming Senate pro tem is going to be a Latina. So that is powerful in and of itself. When you look at organizations, more and more Latinos are stepping into what I call formal roles of leadership, right? And we see reports like the Latino GDP report about the economic power of Latinos in California and across the country. Like we
Over
are
a true.
exactly. It's incredible. And I
Yeah.
think spaces like this podcast, where we share our stories, we share what the data show, are so important because I think in the media environment, in the political environment, there is this narrative of scarcity, like you mentioned,
Mhm,
of, Latino communities are, low income, they have all of the social determinants of health at their disfavor. But the thing is that the reality is it's a much more complex picture. Like both things can exist, right? We can have a large share of population that are low income, and we can be the reason why the California is innovating and we're creating more small business owners at a faster rate than any other community, right? So I think telling the full narrative and the complexity of the narrative, who the Latino community is so important.
Yes, beautifully said. And this is what leadership looks like, right? I am so proud of the work that we've been able to do together. And like you mentioned, very unique space to really focus on that power framing, to inspire our community members, inspire each other to remember that we are strong, and that these narratives, negative narratives, don't define us. I was doing some personal work, right? Reading some Brene Brown, and she talks a lot about shame, right? And how when perceived criticism or an acute attack happens on a person, many times subconsciously we feel as humans that that happened because there was something inherently wrong in us, that something bad happened. And we forget to look and process that situation through a more neutral lens about the situation or the context in which it happened. Unfortunately, once we start living our lives from that place of hurt and shame, it's really hard to not see every opportunity or every difficulty that comes our way with that lens. And I think this is the year, if there's going to be any year where we're going to fight back and really own our power as Latine and Indigenous communities, it is today. And today, with you here, I want to say we're standing up, right? As this is what Latine and Indigenous leadership looks like, and we want more of it. And that's our dream and our vision for
Yeah.
not just the state, but the US.
Yeah, I'm gonna say that all the snaps. And, I think, something that you said resonated with me in the context of imposter syndrome. So sharing a little
Mhm.
bit more about my background, I'm also in the first generation of my family, right, to go to college. And I've been really privileged to gain acceptance and be in these elite institutions, right? Whether it's the top public institutions, go
Mhm.
UCLA, go, Berkeley,
Fight
go Cal.
on.
Yeah, I know. You're perfect in every other sense except for USC. But, no, it's always fun, the crosstown rivalry, UCLA, USC. I had the honor of being selected in the first cohort of the Harvard Doctor of Public Health program, right? And there were times throughout my educational journey
Mhm.
where I felt like it was a mistake, right?
Mm,
Like,
I
the
hear
admissions
that.
committee made a mistake and someone was gonna, like, find out, and, you carry that burden with you,
Mm,
right? And the reality is that, especially in the environment today where there's so many attacks against affirmative action, against, diversity, equity, and inclusion, the reality is that I was accepted, and all of us were accepted to these elite and, colleges and universities and workplaces because of our skill set, because of our intellect, and
yep.
our diversity, that is just like the cherry on top, right? It's
Mhm.
not
Mhm.
it's not because of, it's despite of, right, that we got into these places. So, I think it takes a lot of unlearning, right? To
Um,
be able to let go of that shame, that imposter syndrome, and be able to like fully step into yourself, into your own power. And
yeah.
the thing is, for those, that are listening to us today, once you do that and you step into that place of
Mm,
power, you just let go of the things that
yes.
hold you back. It is such a beautiful journey, a beautiful feeling. You almost feel like you feel like you're a superhero, right? And you can navigate the world in your authentic power, your authentic self. And these are uh, these are this mindset I think it has been really helpful to me as I've navigated even tougher spaces
Yeah.
in government, and in politics, right? So
Yeah.
I think it's important because, I think we need to get to that place. I'm not saying it's easy or hard, and it's a very personal journey, but I think creating that community where we support one another and getting to that place is so important.
Yes. No, I love that. And thank you for sharing that. To go deeper into those systems, right, that you mentioned, being in government, and thank you for your service as USHHS Region 9 Director. We were so proud and excited to see you in that role and everything that you accomplished in that leadership position. Tell us more about your professional journey and how you got to where you are today.
Yeah, it's in retrospect, when I hear my bio, it's like,
Mm,
I do have moments where I have to, like, pinch myself, like, "How did that
mm,
happen?" But, I think as I think about my journey, my background, so I graduated from undergrad, and it was at the height of the Great Recession,
mm,
so not really good job prospects out there. Had a couple of part-time jobs. I was a research assistant at UCLA School of Public Health. I was an AmeriCorps member at a federally qualified health center. Shout out to Ultimate. But I knew I needed more skills and training. That's what took me to public health school, and where I got my master's at Cal. And at that time, it was the start of the implementation of the Affordable Care Act. So a lot of energy around, Medicaid expansion to adults, and not just pregnant women and children, and creating those systems. And I wanted to be involved with that. So I worked for a county health department, and really where the rubber meets the road, right? Of policy and programmatic implementation, and got really into the weeds of like developing like a guide for like the call center, from like routing calls from like Cover California to the county eligibility workers. And so that's kind of like the start of my journey in public health, is really at a local level, at a grassroots level. And I think still today, that work is so meaningful to me, because I do think that we create, these policies at such a like high level, and so
mhm.
abstract sometimes, and so disconnected from
Yeah.
community. But because I started there at the ground level, I bring those experiences now, right? As I've been in these positions, fast forward to HHS Region 9, a very high level position at HHS in the federal government. And I was really, just honored to serve President Biden, Vice President Kamala Harris, to be asked to serve and to join the team of our first Latino HHS Secretary, Javier Becerra.
Powerful.
It was such an honor to serve someone who has such a track record of standing up for healthcare rights, for immigrant rights, LGBTQ rights, and be able to uh, be at HHS in the moment when we think about the start of the former administration. It was trying to get a handle on COVID, right? And trying to get a handle of ensuring that more Americans got coverage, whether it's through Medicaid, through the state healthcare exchanges, or the national
Mm,
exchange, the Obamacare exchanges, or through Medicare. And what I really want to highlight from my time at HHS Region 9, one of the things that the former administration would be so proud of was that the Biden Harris administration was the most diverse in history, and
mhm,
diversity across so many identities. It wasn't just racial, ethnic diversity. It was, geographic diversity. So more rural Americans serving in administration, or that had that background, more first generation college members of the administration at any point in history, more LGBTQ Americans than at any point in history. And so,
beautiful.
that diversity created, I think, new conversations at the highest levels of government, at the White House and at the agencies, right?
Mhm,
And so whenever we were thinking about policy decisions or programmatic decisions at HHS, equity and diversity was always at the center. The secretary would always talk about we're doing equity by design. We're not thinking of
Mm,
this as an afterthought, but in the very start of the conversation. And so when we think about some of the like successes that we had around closing the gaps in racial ethnic disparities with the COVID-19 vaccine, it was
mhm,
really I do think we don't get enough credit for the work that we did to invest in
mm,
community health centers, to invest in promotoras and community health workers to carry out the vaccine program. And, it was the largest vaccine program in US history, and we were successful in doing it with equity in mind. And the secretary, another quote, he had so many, but another quote that he would always tell his team, and he would encourage us to think about is we're not waiting for the American people to come to us, but we're going to the American people. And we really live that every day.
love that. I love that. Thanks for sharing. Not to go down this rabbit hole, but I think it's important that we acknowledge how different that reality is today. Um, 2025 has been a very tough year for all of us and our communities and our systems, our health and safety net infrastructures. How how does it feel now to be looking at this, the beauty of what could have been and what you saw and helped shape in terms of that the power that these systems can hold in helping and supporting Americans across the US, and now see that ripped apart brick by brick by folks without compassion, without a vision for how great America truly could be if we took care of our most vulnerable.
Yeah, this is a tough question, and I'll be like totally honest with you. It's devastating, it's heartbreaking, it's infuriating, like all of the emotions that come with investing so much in a vision for America around advancing health equity, increasing access, improving quality, all of the work that we did round the clock, 24/7 for 4 years, to see it so quickly be dismantled
Yeah.
in a way that is purely partisan, by the way, and has no science base, has no public health base. Um,
Mhm.
and this is unprecedented. I think we have to say it. Like, this did
Yeah.
not happen under former Republican administrations. It didn't happen under
Mhm.
George W. Bush. It didn't happen under Ronald Reagan. They weren't, the best at public health either, and they had their challenges, but they never went after the career civil servants. Like, these are
Yeah.
folks that are there to achieve the mission of the department, and they're there to serve the American people, to serve
Yeah.
everybody. And the current partisanship and the leadership right now at HHS is there to serve one very specific political agenda and to serve one group of Americans and to discard another group of Americans. So it's heartbreaking. But, because I don't want it all to be doom and gloom, let me share a little bit more about what I did at Region 9 as regional director and what gives me hope, right? Because I do want to focus on hope.
Yes.
As Region 9 director, one of my priorities was establishing and building off of the relationships that have been developed around COVID-19 and the equity response to COVID-19, and really strengthening those partnerships with all communities, right? So within my office, we worked really closely, for example, with the White House Initiative for Asian American, Native American, Asian Americans, Native Hawaiians, and Pacific Islanders, WIAMPI, as it's called. And we were really closely in Region 9 because we have a sizable population of AA and NHPI members of our community, including the Pacific, right? So my region covered Hawaii and the U.S. affiliated Pacific territories, so like the Commonwealth of the Northern Mariana Islands, Guam, and establishing those relationships so that when there were issues on the ground and folks
Mhm.
weren't, the right program, or there were grant opportunities that
Mm.
could be beneficial to address a local need, they knew who to call, right? And we could help them navigate the bureaucracy that is HHS. So that's one example. Another
Mhm.
example is working with our tribal nations and tribal communities and tribal nations. Within our office, we had a tribal liaison, and us covering southwest of the United States, we had a
Mhm.
sizable tribes, the second largest of any region in the country, 157 federally recognized tribes, and
Wow.
having that nation to nation relationship through consultation. And then we also have a sizable urban native populations, right? So through urban native conferral and supporting tribal health programs, I think was so important. I think as Region 9 director, one of the one of the things that I was really moved by were the tribal leaders that invited me to their communities to just be
Mhm.
in community with them and, get to know their members, their
Beautiful.
food, their way of life. And it was really powerful just seeing that for myself, right? Because the Indian Health Service, IHS, it's a completely different health system, and being able to be exposed to that and be, an advocate for them at HHS on the inside was really powerful for me. Another community that, that obviously is close to my heart, the Latino community, as, one of the only regional directors at HHS in U.S. history had that Latino background, that immigrant background. I was tasked by Secretary Becerra to support a Latino health tour. So being able to, partner with organizations like LCHC, community health centers that were predominantly serving predominantly Latino and immigrant populations, and being able to establish those partnerships, so powerful. And while we didn't get, all of the policy movement that we wanted to in 4 years, right? What I'll say is once you build a relationship with somebody, and
Mm.
it's a real relationship, those relationships are going to last the test of time. So what my hope is that that infrastructure, those relationships, those community-based relationships with CBOs, with community leaders, they're going to outlast the current challenges that we're facing right now as a country.
Yes, yes. And something that's coming up for me as you share that, it's that around relationships. And it's that Maya Angelou quote that says, people may not quite remember all the specific words that you shared, but they'll remember how you made them feel. And that's why there's so much power in relationships, because at the end of the day, when we're on a time crunch, when we are trying to get something across the line, it's that call, is that quick text that we can share to get that support to get something over the finish line. And how important in today's day and age, with where technology is, AI, how important it is for us to remember to connect as human beings.
Mhm. 100%. I don't know why this story is coming up for me, but a really powerful moment when I was at Region 9, we were able to bring the secretary to have a roundtable with farm workers up in the Sacramento area, and in Clarksburg,
Amazing.
California. And it was a small group, well, not that small, maybe about like 30 or so farm
Mhm.
workers, and all mujeres, by the way. And
Yeah,
during their
mujer.
break, yeah, I know. During their break, they were just sharing, their experience, and what they contribute to this country, right? And I want to go back to COVID and the moment of COVID where we deem so many workers essential workers, and I want us to not forget that framing because the people that make the economy run are not the CEOs. but it's the
Mm,
farm workers, it's the restaurant workers, it's the
mhm.
drivers, like the promotoras, right? These are the people that make our economy run. So, like, picture this, like 30 mujeres, farm workers, campesinas. I'm having a conversation with Secretary Becerra, the first Latino in the role, a member of the president's cabinet, on the line of succession to the presidency, right? And, the secretary was himself. He's the son of immigrants from Mexico as well. He grew up in the Sacramento area, so it was normal, like it was normal territory for him, right? So that
Yeah.
he, right, as he always has to go. He's
Yeah.
on a time crunch, and I overheard some of the conversation, and one of the campesinas shared with me, like, she said, "Oh, ese señor es importante y
Mm,
es buena persona porque vino aquí a hablar con nosotros y a oír
yeah.
nuestras historias," right? So to your point, like, the secretary, I'm sure, gave his stump speech around, how many folks we got on Medicaid, how many, like, shots in arms with COVID, as he always does, like, all those numbers and figures and facts, all the policy change. But for her, for that campesina, right, it was,
Yeah.
how did he make me feel? And he acknowledged my dignity of work, right? And that human to human connection, so important.
That's beautiful. Thank you for sharing that. I think I'm calling back something you shared earlier about your professional journey and where you started and how you built up from, being at Ultimate, being at a health center, being that research assistant, and building up to the powerful levels of formal leadership that you've held. And thank you for your humility as you're sharing, because these are important roles that, with that formal ownership and responsibility, you're able to impact so many lives across the US. So thank you for doing that work. And maybe for our folks listening today, what would be your two words of advice for someone listening and saying, "Man, can I get there? Is this something that's possible for me?" How would you encourage that person today?
Yeah, it's a great question. I think the way that I'll, like, answer that is reflecting on my leadership. I do think that y the positions, like, my just to take it back a little bit. So, the my educational journey and the skill sets that I learned, it was almost like learning a new, like, language, right? And building up your toolbox. So with every, degree that I had, it was about building up my toolbox and working on kind of the formal position of power, right? And I knew that that's something that I needed to do. But really, in terms of, like, my vision as a leader of, like, what matters when it comes to addressing health disparities, having a vision for health equity, for health justice, that's my lived experience. Like,
Yeah.
and so many people out there come from that, come from that
Yeah.
background. They may have not shared my exact story in terms of my family story, but they have their own similar stories. And so with that, I would say lean in on that, because I think that we overcomplicate sometimes
Mm,
leadership or policy or systems change. We overcomplicate it with, like, technicalities and,
yeah.
like, policy can be very complex. We have a lot of, like, very smart lawyers that get in there and make it very complicated. But at the end of the day, for me, I'm like, it's all about how do we simplify systems to, like, meet community needs, right? And I think I didn't really learn that from institutions of
Yeah.
power. I really didn't. I mean, that was, Jeffrey growing up with Alicia and Jesus and my brothers. I learned that from home.
That's beautiful and very powerful. Thank you for sharing that. So, with that vision that you mentioned, what is your vision for health equity? How do we get health equity across the finish line? What's left, and how do we make sure we get there?
So I'll answer that just by sharing that I do think that health equity, the movement towards health equity, I do think it's a multi-generational struggle. And I say that in the context of, like, for example, civil rights, right? So, Medicaid, Medicare, they were established with the support of the civil rights movement, right? Around that time, and and I really believe that it's gonna take multi-generational movement to actually
Mm.
achieve equity, and it's something that we can't lose sight of. It's a
Yeah.
ball that we can drop, and every generation has to take the baton or the ball from the prior
Yeah.
generation and fight for it, because as we're seeing right now in the moment today, it can easily be dismantled if we don't fight
Yeah.
for it. So, in terms of where we're at today and how do we achieve health equity and how do we achieve health justice, for healthcare in California and across the country, I'll share 2, maybe like 3, solutions that I think are
Mm.
important. Uh, the first, just starting out, from the ground, I do think that we need more diverse voices in the workforce, right?
Yeah.
So I think the workforce component is so critical. We need a workforce, whether it's in healthcare, whether it's in human services and mental health and public health, that is reflective of the communities that are served. We're not there yet. It's improving, but that progress is so incremental. We do have more Latino, Latina physicians. We do have more Latino, Latina public health professionals in the field,
Yep.
but the rate at which those increases are happening over time are not where they need to be. So I think greater investments there. And
Mhm.
I also think, related to that, that how we deliver healthcare and how we deliver mental health, how we deliver social services, I do think that maybe the programs need to shift to be more adaptive to diverse communities. So I think that maybe we need to like revisit what some of these programs are. I know folks get really, they get really close to their programs and
Mm.
their interventions, but I do think that maybe we need different types of interventions to create a true, accessible, community-centered, healthcare system, public health system. So we'll start there, number 1. Number 2, getting to full coverage. I mean,
Mm.
been decades and decades of organizing, coalition building to get to full coverage, regardless of income, regardless of status. I think full coverage is the goal. We got close to it under the prior administration. Um, over 300 Americans had some type of coverage under Javier Becerra and Secretary Becerra. By the way, we passed a policy at CMS that would have allowed DACA-mentored individuals to apply under the under covered California here in California or the healthcare exchanges.
Yeah.
Obviously, that was rescinded under the current administration, but I do think that if you don't have coverage, then you can't access all of the
Mm.
services. So that's at a very basic level. We need to support full coverage for all. And then, like, finally, kind of the third area that I spend a lot of time, with my public health training, and I think we did quite a bit of work in this space under our watch the prior 4 years is address social determinants of health. Like, we know that so much of our health outcomes for our communities, it's not just within the doctor's office, within the 4 walls,
Mhm.
but it's
Mhm.
our access to educational opportunity, to economic opportunity, access to clean drinking water, to, a safe, not only physical environment, but, the air we breathe, all of those social determinants of health and investing in partnerships to address that. I think will get us to a point where we're not just like trying to solve a huge problem with a band-aid, right? But we're
Yeah.
thinking the source and getting to the source and really thinking upstream.
That's powerful. Thank you for that. And that's why we need you in these positions to continue to advance, to continue to inspire minds, Now, as a professor teaching public health, right, you are teaching those young minds to enter the workforce with that mentality, with that framework in mind, so that regardless of where they land, they can be those little Trojan horses within systems to transform and re envision a future that really encompasses all of us and all of our needs and unique diversity.
And I think, that's one of the reasons why as I'm transitioning to this next chapter of my life, I'm an independent consultant and I'm supporting groups, health centers, and CBOs speaking at their events. And I took on this teaching job to support the next generation of doctoral public health trained leaders. And it really does give me hope, that our future is in good hands, and being able to share my knowledge and my wisdom with students, it's really been a place of hope for me, because I'm the type of person, if I think for everybody really, not just me, but when we kind of get into ourselves and don't engage with our communities, it can be really depressing. So for
Yeah.
me, engaging in that way, it's a way to uh, be 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 of service, right? Going back to service and being of service, I think it's really important. The other thing that I wanted to share around kind of the future and where I think the future needs to go, and I think this is part of our culture as well as immigrants, as Latinos, Latinas, Latinx community. I think that we're very innovative. It's almost like when we see a problem, we don't leave a problem there. We figure out
Yeah.
any way to fix
Mhm.
that problem, and I
Mhm.
find myself, at the highest levels of government, you hear conversations and people are like, "Well, we can't do that." There's a lot of "can't," and I'm
Mm.
always, "No, yeah,
That's
we."
not in our vocabulary as Latinos.
Right, and,
You mean this door is closed? There's 10 more that I can open, don't worry.
and I like to say, obviously I'm Mexican, right? Mexican American. We're not Mexicant, we're Mexican, so we're gonna
There
make it
you
work,
go, there
right?
you go.
So with yeah, yeah, so with that, I'll just share that I think the future of health equity is really an acknowledgement that obviously these disparities exist because of systems that weren't set up to be fully inclusive and accessible to all communities, right? And I think we need the leadership and the framing of people that are willing to be bold and not stay within old ways of thinking, because I think old ways of thinking got us into the disparities that we see now. So I think right now is a real opportunity. I think some of the best innovation comes in
Mhm.
moments of crisis, right? And we have a lot of great leaders here in California that are trying to innovate through this crisis. And, I want to be a part of that solution.
Yeah, no, I 100% agree with you. I think California has a very amazing opportunity in their hands to really transform public health, transform healthcare delivery systems, our safety net systems. How do we build our own California infrastructure so that regardless of who sits in the presidency or even the next governor, that we are protected and those key health and human services programs, initiatives are protected as key to keeping the state healthy and our state economy well. So it's it's something that makes sense from every aspect. So how do we start building that now that there's these difficulties coming at us? How do we use the difficulties to now transform and create something that actually works for all of us?
And, I think one of the justifications for why we can't do X, Y, or Z And we saw it, I think in the last legislative cycle, you all did incredible advocacy to protect the Health for All program, right? Medicaid for all, Medi-Cal, regardless of status. Vulnerable communities are the first to be cut out of
Yeah.
programs, and it's unfortunate. So my question would be, if the justification is there's not enough money, so from a business or an executive perspective, what are we spending our money on?
Yeah.
What there I am almost confident if you go deep enough in the budget, there are programs that maybe aren't as
Oh,
impactful, or they were evaluated, they're evidence-based, but they were evaluated on populations that aren't the current population in California, right? So I think it's an opportunity to, take stock, and an assessment of where are we spending our dollars? And, going back to, uh, our community coming from a place of strength, we're 40% of the state.
yep.
California is not California without Latinos, without
Yep.
immigrants. Immigrants make up, a third of every Californian. And so we need to demand that programs serve us. It's no longer a handout, right? But we invest in you. You, our government, should be reinvesting back in us. So I think reimagining what those programs are, what that safety net is when we need it, right? As a community, I think these are conversations that I know are happening, but we need to continue supporting.
Yeah, no, that's a great point. And, to go a little deeper on that, Latinos make up 40% of the workforce in California. And when you think about the theory of human capital, which tells us if we keep our population healthy, you are keeping folks that are going to their job, showing up day to day to put in a hard day's work. Kids are showing up to school. We're continuing to grow as that bigger population in California, and we're keeping the economy running. We're keeping the economy healthy so that when we do share stats like California is the fourth largest economy in the world, we're saying our hardworking communities are what is keeping us in that place. And if we want to continue seeing that, we have to take care of Californians' health and safety net.
Couldn't have said it better myself. 100% right.
Wonderful. Wonderful. Well, maybe to just wrap up our conversation today with a fun question.
Okay.
How are you taking care of your mental health? Share some tips.
Great question. I think I'll answer it with going back to the moment that we're in. I had to step down from my position as HHS regional director because of the election and the change in administration. So it was really an opportunity, almost like a blessing in disguise, right? It was an opportunity for me to pause. And I had, the first half of the year, I was completely on sabbatical,
Mhm.
and I just started to take care of my needs, right? Eating healthy, working out, going to therapy. I think it's something that a lot about as much in the Latino community that, we all can benefit from therapy and helping have a neutral therapist just support us in our own personal journeys and being able to impact some of the traumas that we experienced growing up. Uh, Being able to connect with friends and like-minded folks, that's been incredibly empowering. As an independent consultant, I've been able to speak to different groups across the state, and every time I go and just talk to people that are doing good work, just really is so motivating and just helps my mental health that, we're gonna be okay because there's so many people out there that are working every day to provide care for our communities. A little bit of travel as well, being able to explore, and I think, as immigrants, we have this, like, hustle mentality,
Yeah.
right? Like, we always need to be working, and, you know, it's something that I think is part of, being that first
Mhm.
generation in this country, that we almost have to, like, show our work, so we overcompensate on the
Mhm.
work, right? But I think that balance is important. And it's not selfish to take care of yourself. And in fact, it's helpful not only for yourself, for your own well-being, um, for your longevity in the work, but it's helpful for everybody around you. So, yeah,
Yeah,
take care of yourselves, people.
I love that. It's necessary that we take care of ourselves, and we're in a long race for the next 3.5 years, and acknowledging even folks listening in today. If you're feeling tired, exhausted after the 9 months that we've been in, right? At LCHC, we've talked about the term moral injury and
Mm.
how we're facing these moral injuries almost on a day-to-day basis, right? When we see our hard work being dismantled and communities actively hurting, and yet we have to put ourselves back together and throw ourselves into the work as if nothing else is happening. So want to acknowledge that all of us who care deeply about people and this work are hurting, and yet we are working at 200% because that is where we need to be. Please take care of yourselves. We can't have you burn out. We need you for the long run. And please start with your mental health, your physical health. It works wonders when we're actually able to rest and be well.
That's so I mean, you said so well, and just wanna acknowledge all the work that you do for the state,
Oh,
for our comunidad and the team, and Latino College Valley, California, the board, all of the partners. Like I see that hard work. I know it's so hard because we're carrying the weight of our families, our
yeah,
communities, our ancestors. We carry that weight every day. And it's okay to take a break and then also to lean on one another.
yeah,
And that's where, I think our community shines, right? We're there for one another. And we have those strong social ties, those social connections, and
yeah.
uh, that's what's gonna get us through. And comunidad, we're gonna get through.
That's beautiful. With those beautiful words, we'll end our conversation there. Thank you so much for joining us today. Y a tu salud.
A tu salud. Gracias.
Yes.